Good morning. I'm Shawn Bennis. I am the coordinator of Henry Ford Health System's Family Caregiver Program. And joining me today is Dr. Rana Awdish. Hi, Dr. Awdish. She is a critical care physician for Henry Ford Health System, as well as the medical director for the Care Experience. And she is also the author of the book In Shock. So welcome. And thank you for joining us today.
I'm so happy to be here. Thank you, Shawn.
Yeah, so can you tell us a little bit about what the Care Experience Department is and what you're doing for Henry Ford Health System?
Sure. The Care Experience Department at Henry Ford is really geared towards providing the best care experience possible for our patients. One of the things that I learned from my experience as a critically ill patient that I really wanted to make happen when I came back to being a doctor was just improving the communication that happens, especially between doctors and patients, but really the whole care team's communication improving. So much of good care requires good communication, and so we focus a lot on that in Care Experience.
Okay, so communication is so important, and I believe that our audience, mostly caregivers, wants to know how does a caregiver fit into that physician-patient encounter or that visit? What can the caregiver do to make that visit even better for their loved one?
Caregivers are the linchpin to receiving really good quality care. From our perspective as physicians, we love it when patients bring a friend or a family member with them who can help in the visit. There are many different ways that caregivers can help. One of the simplest ways is just by being there, providing that support for the patient in the encounter. Sometimes when you have a doctor's appointment as a patient, it can be very overwhelming. All of the news you're receiving is about you, and it can be hard to absorb all of it. Having someone with you who can take notes that you can refer to later, someone who can maybe ask that question that you said in the car but then are forgetting to ask because it's all a little bit too much sometimes. That person's so valuable.
Wow, that's important. So they should probably bring a journal with them and maybe talk about these questions ahead of time. Because I know when I go to a physician, I might have 10 things that I want to talk about. But I'm sure the physician also has a bunch of things that they want to talk about. So how do we prioritize that? How can the caregiver help their loved one? Like, okay, what can we do with this list of questions?
So what we teach our physicians to do in our communications courses is to really try to draw out from the patient and the family, what are you hoping to cover today? Tell us the issues that you want to be sure are addressed before we finish today's visit. We as doctors have our own list, the things that we're worried about, concerned, want to address, but it's only a complete visit if everyone's needs are met. So if you can have that list, we love seeing a journal with symptoms that are documented. That helps us so much, just writing down what's been happening for you when we don't see you. But then to also know what you want to discuss to make it an effective visit.
Wow, that would be so powerful. What if a doctor asked you, what do you want to accomplish at this visit? I don't know if I've ever had a doctor ask me that.
We're working towards it.
That's wonderful. So towards the end of the visit, so you have that small time frame. What is it towards the end of the visit where that it's wrapping up, right? That patient and caregiver, like, I know this is ending, right? What are some important questions that they can ask the physician to make sure that they understand everything, all that information that you're trying to give us?
So there, I think it's really helpful to think about what's happened in the visit. Was a new medicine prescribed? Is there testing that needs to be done? Because the questions you want to ask are really about next steps. How will we know the treatment is working? What should we look out for? What are side effects that would be concerning to you? How do we go about getting these tests scheduled? You really want to be sure that whatever plan you've co-created with your team, that you have all the tools you need to carry it out.
That's great. So are there other tips that you want you want to suggest? Other people that they should draw upon for support?
You know, many clinics have a lot of resources beyond who you might see that day. You might see a physician, but that physician might have a nurse coordinator who helps to coordinate care. They might have a pharmacist. You know, in our pulmonary clinic, we have a pharmacist that makes sure you're using your inhalers right. If you can find out what other resources are available to you, you know, that might even be an online portal where you can check your labs, or the caregiver can check labs. Those are all ways that you can continue the care even after the visit's ended.
Wow, that's great. So can they get in touch with their physicians even in between visits?
Yeah, you know, at Henry Ford, we really encourage the use of MyChart. That's our online platform, and we respond to messages securely through that. It's as easy as providing your email address.
Wonderful. So any other last minute tips?
I want caregivers to know how valuable they are. Without my mom and my husband helping with my care, I know I wouldn't have gotten through my own illness. You're more valuable than you can imagine.
Oh, that's so wonderful. So this book is fabulous, and I know you don't want to promote your book here, but I just want to say that there's a lot of other tips in the back of the book, plus Rana's whole journey, that she has gone through will really make you understand how this has changed her as a physician and how we're changing everything here with physicians that are new coming in as well as the established faculty. So thank you so much for sharing your information with us. As always, there is the whole caregiver program here too to help support you. We have support groups, we have classes, and we have a whole website of information. Email, phone number to ask questions. We'll put that all in the comment section below. But again, I want a sincere, heartfelt thank you to Dr. Awdish for joining me today and sharing all of these tips with you. So have a great and wonderful and safe holiday season. Thank you.